Hey everyone, Bridget here at the AAFE Training Center. We are just treating my patient with some neurotoxin today. So as you can see, I am marking the patient up. We are going to be treating frontalis, glabella, crow's feet, and then also a little bit of a brow lift. So that's what you see me marking up here. The biggest thing with your frontalis is making sure that you're treating all the way to those lateral edges of the muscle, or else you can get what's called a spocked brow, which is essentially where part of the brow is raising up because the frontalis is active in the lateral portion. So just making sure to treat all the way out so that your patient does not develop a spocked brow is very important. I am going to start on one lateral border and kind of work my way over to the next. I came up with my patient's dose depending on the set of her eyes, how much movement she had, the size of her forehead, and then just how kind of frozen or still she wants to be. Some patients want to be pretty still, so I'll go a little bit more aggressive. Some patients want to still be pretty natural, so they want to have some movement. So it's just kind of depending on the patient. Everyone is different. Not everyone is going to get the same dose. And there are multiple reasons why they shouldn't get a certain dose. Next, we are moving on to the glabella, where I am going to be treating the procerus and my two corrugators. I'm going to treat the medial portion and the lateral portion. The medial portion, you want to make sure that you are 3/4 your needle depth, and then you always want to make sure you're no more than half your needle depth on your lateral corrugator. The reason for this being is that your frontalis sits right underneath of your corrugators. So if you go a little bit too lateral, or if you go a little bit too deep, you're going to hit the frontalis, which is then going to give you a dropped brow, which most patients do not want. So just making sure you're being really careful about your needle depth. Here I'm doing a little bit of a brow lift, so I'm actually treating the upper portions of the orbicularis oculi muscle, which can help kind of like prevent that squinting effect. So when I had her make that face, it's going to help relax that, which will then in turn kind of lift the brow. You can lift more of like the arch, you can lift the tail. It's really wherever you're seeing the most movement is where I usually treat. So on her, I treated a little bit further out, like closer to the tail. And then I always like to make sure that I treat my lower crow's feet. Some patients don't want their crow's feet treated, which is completely fine. But sometimes if you kind of like paralyze the upper half of the muscle and you don't do the lower half, it can sometimes look or feel a little weird for the patient. When you're treating the lower orbicularis oculi, you always want to make sure that you're extremely superficial. Once I get down to these lower injection points, I'm more at risk for hitting my zygomatic major, which is the muscle that pulls up and back the smile. Obviously, that would not be ideal to hit, as then it would affect her smile, which I don't think she would be very happy about. Thank you so much for watching.